So good morning, everyone. Welcome. My name is Julie Bershatsky. I'm the Director of Community Living and Employment here at the Institute of Community Integration at University of Minnesota. My preferred pronouns are she, her. I am a white middle-aged woman with short black hair wearing a black University of Minnesota sweatshirt. I'm sitting in my home office with lots of books behind me, and you may see my dog once in a while, or his tail at least, kind of make its way through. Thank you for joining us for this edition of the ICI Policy Forum. We try to do these on a regular basis, once every few months. We had to reschedule the last one when this was scheduled last, and I apologize for that to our discussants first and foremost, but also to the audience. We had technical issues that were unfortunately last minute, could not be figured out. So the topic today is the same topic that was supposed to happen a couple of weeks ago. It is based on the latest edition of the Policy Research Brief. The title of that brief and the topic today is the employment impacts of being a family caregiver. Some housekeeping notes: the forum is being recorded as usual, will be posted on our site along with the slides, and we will give a link to where they will be posted at the end of the forum. Today's discussants are my colleague, Linda Anderson from ICI, Alisa Ware, the Executive Director of Family Voices, and then Megan Burke, Professor of Special Education at Vanderbilt University. I will ask them to introduce themselves shortly. As all our policy forums, this is an informal discussion. Feel free to chime in at any time, either voice or chat. Linda and I will monitor chat and we'll post questions as they come. We'll also have some audience discussion questions at the end. Reminder to please be respectful of others' opinions. Some of these topics elicit a lot of emotions, which is totally fine, but just be respectful of others' emotions and others' opinions. With that, let us get started. I'm going to ask our discussants to introduce themselves, and then we'll briefly talk about the issue and the data before we launch into the discussion. Linda, would you like to introduce yourself?
Yep. I'm Linda Lottie Anderson. I work at ICI with Julie. She, her pronouns. I'm a middle-aged white woman with blonde hair, and I have the University of Minnesota colors as my background, maroon and gold. Alisa, do you want to go next?
Sure, I'll go ahead. Thank you, Linda. Hi, everyone. I'm Alisa Ware. I'm the Executive Director for Family Voices. I'm also a middle-aged Black woman with a gray turtleneck dress and plants behind me is my background. And I am glad to be here. I'll pass it to Megan.
I am Megan Burke. I'm a professor of special education at Vanderbilt. My research looks at how families navigate and access services for their family members with disabilities. I'm a white woman with short brown hair, and I will turn it back to Julie.
All right. Thank you to the three of you for being here. As I said, today's policy forum is about the employment impacts of being a family giver. Let's see, why is this not going? There you go. And this is just to show you, this is the actual policy research brief that the conversation today is based on. It's a two-pager, front and back. It can be accessed, downloaded from our policy research briefs website that I will give a link to at the end. And these are the findings, and this is the data that we'll sort of use to talk through the discussion today. So Linda, if I can ask you to talk about sort of the research issue and why we're talking about this in general and why we're looking at the data and why this is important. Linda, you might want to unmute yourself.
Unmute myself, yep. In the United States, about 80% or so of people with intellectual and developmental disabilities live with a family member. So they play an important role in supporting people and even amongst people who receive formal supports, more than 60% live with a family member. And so families provide a really important role in ensuring that people's needs and support needs and other needs are met. But we don't do a really great job of providing support to the family members who provide support. The FINDS is a survey that we do in conjunction with the ARC. We did one in 2010, one in 2017, and then we did this one in 2023. And it's an online survey that's distributed across the United States and across in the territories. We also get participants from the territories. So we had participants from every state and 3 of the territories. Oh, that's on there. Puerto Rico and Guam, and I think also Micronesia may have also had one person participate. So the survey this year was available in English, Spanish, and French, and simplified Chinese, in hopes of making it more accessible to more people. It does not include anybody whose primary relationship with a person with an intellectual disability is as a direct support professional. That's not to say that the family members might also be paid to provide support, but that's not their primary role with that person. And we had more than 3,000 people complete the survey with enough data that we were able to use their responses.
Thank you, Linda. I just want to address a comment in chat about pinning the presenters. The 4 presenters are pinned. So Linda, if you want to wave, just so people know who you are. And we'll just, the 4 of us you will always see on the screen. So it's going to be the 4 of us that will be talking. Okay. So the next few slides are just sort of going to present the key findings from the brief. We're going to talk through what the key finding is, and then we're going to have sort of a discussion with our panelists around those key findings. I have some questions for them that sort of came to me as I was looking at those data. So that's how we're gonna go through. Feel free to chime in and ask questions. Again, either in chat or raise your hand and unmute yourself. And we'll just have a conversation around that. All right. So first key finding, it's a busy slide, but I'm going to ask Linda to summarize it and just tell us what we're looking at in general, and then have some questions about it.
So we asked the people who responded to the survey if they were currently employed or had previously been employed outside of the family home for pay. And so 9 of 10 reported of those who reported being employed or recently employed had also one employment related effect due to their responsibilities in providing support for their family member. Most of them needed to take time off during the day, go in late, leave early in order to provide supports. A number of them were purposely underemployed, more than half, in order to provide supports. And this is interesting and why it's important to talk to people with lived experiences. We did not have this question originally in this survey. And the last time I presented this information at a conference, some people came up to me and said, wow, you're missing something really important. And it is, more than half of the people responded to being purposely underemployed. Some people went from working to full-time to part-time, and those are all half. But if you look through the list, people retired early, they quit, they gave up working entirely, they took leave of absence in order to be able to provide support to the people on their families.
So then my question looking at this is, what are the implications, especially the long-term implications of just this large effect that we're seeing and how many people it affects? And I'm just going to pose this question to all 3 of our discussants. Whoever wants to start first, from your perspective.
I'm happy to start, Julie. So thank you. And I'm actually glad, Linda, to hear that this was added, because I think it gives us a lot of information around how people are working around the realities of caregiving. What we've heard from our work with families at Family Voices are kind of 5 or 6 key implications where what families really feel. One of them being, the financial security of the family, I think is really one of the big things that are at risk. The actual upward mobility, to be able to actually, whether it's access home ownership or be able to move and engage in things that impact quality of life can be really big impacts and affect ultimately how people live and their health and well-being overall. I also think it, as we can see from here, it impacts lifetime income potential, which has generational consequences and implications, right? What we leave behind for people that, our family members, what's there and available for our child with special health care needs, should we not be there? It all is impacted by how much we make and our income potential. And the final piece that I'll just say is really kind of the stress on the system. We know that when people have financial insecurity, when there are concerns about their ability to maintain employment or continuous employment, that's going to put stress on a system that already has stress from the realities of navigating the healthcare system and the needs of the person that they're caring for. And all of those can impact overall health. And have even adverse health outcomes, not just for the individual with intellectual and developmental disabilities, but the individuals in the family system overall.
I could not have said that better. Elisa covered the entire, spectrum of implications of this for families. I think the one thing I would add from a research perspective is that a lot of research shows that there is an impact on employment for family caregivers. What's so nice about this is this shows that there's kind of different ways that caregiving impacts employment, right? And it's not just not working, it's also underemployment, and it's also turning down opportunities for advancement. And I think this gives us a lot of food for thought and a lot of richness in looking a little bit more carefully, and not saying this global, like there is an impact on employment, but like it looks really different and for different people and in different ways, which I know we're going to dive into. And so I think there's just a lot of room for growth in terms of research to better understand this.
I don't have anything to add that Megan and Elisa haven't already said, so.
I'm curious then, I'm a data geek too, so I'd like to look at like specific numbers and try to figure out what they mean. So I'm looking at some of these, and so many, they're stark, right? They're striking.
Yeah.
In particular, what sort of raised my curiosity is this 32% that turned down an opportunity for career advancement in another state. I mean, it's a third. It's not the largest percent, right? But it's a third. So I'm curious your perspectives on what this is about, this other state, and why this question was even posed that way. Another state, for example.
Well, I think it's fairly simple. Not every state has its own Medicaid system. Some of them have waiting lists for up to 20 years. Some of them may not offer the same benefits that your state offers. And so it's a very careful decision about, well, if we move, will my family member get the supports they need? How long will it take us to get those supports? And if we can't get the supports we need, do we have an informal support network that can help us bridge the gap until we can get the formal supports we need? I think that it boils down to that Medicaid is not a national system, it's piecemeal, and it makes it hard for people to think about moving to another state if they're going to lose important services for their family member in the move. Maybe Elisa and Megan have other thoughts, but that was mine.
Go ahead, Megan. Go ahead.
I think it's exactly what Linda just said. I think it's formal supports and natural supports, and it'd be nice to understand a little bit better if one of those matter more than the other, or if one of those are the main drivers, right? Because it could also work in the other way, like you're locked into a state that you're currently in because your child is receiving services, or conversely, you're not getting any services in the state you're in, and so you are moving to a state that provides services. Or those two things could also be in conflict with one another. Like you're in a state where you have a lot of natural support, but you're not getting formal supports, and you consider moving to a state that doesn't have a wait list, but you wouldn't have natural supports. I just think the balance of those two things, there's so much more to understand there.
Yeah, I don't think I have anything to add. I mean, I'll tell you that actually because we're a family-led organization, most of our families are caregivers of individuals with disabilities or special health care needs. And I have a staff member right now moved from Pennsylvania to Massachusetts. 2 children with developmental disabilities, and but there was an employment opportunity for their spouse. So they had picked up, moved from Pennsylvania to Massachusetts. And Massachusetts said, your child never had an ADOS. So we actually can't offer them any benefits, not Medicaid. Not, so now here's this $5,000 test that needs to happen, right, in order for them to even access the Medicaid system in another state. That's one family story, an example of how difficult it can be to shift from one system to another. And it's not just, I have to go get re-signed up. Every system's going to have its own qualifications. Yeah. Every system's going to have its own realities. And what do you then have to go through as a caregiver to access those services in a place that you've never lived, to actually get the testing or whatever needs to happen in the paperwork and documentation. It can be so much to take on that some people go, I'm just going to stay where I am. But I also just want to echo kind of what Megan said about the role of natural supports, and because of the caregiving needs and realities and the lack of respite care that we have in this country, the lack of, other supports that exist that are easily accessible. If you have those natural supports and families around you that allows you to get the rest that you need and the support that you need, that data certainly makes sense. I'm actually surprised the number's not a bit higher, because it really is. It gets to that quality of life piece that people are looking for, and the balance in order to be able to meet their own needs and the needs of their loved one.
I'm trying not to get too depressed at the moment, but it's, yeah. All right, thank you. Let's go to our next discussion point, because now we're going to start looking at sort of some of the things that may drive these effects that we're seeing and some of the differences in these effects. So second key finding, Linda, describe for us, please.
Sure. I think it's probably not going to be a surprise to anybody that household income plays has an effect on whether or not on the choices people make. And the maroon color are people with lower income. And we did the cutoff at 60K and above and below 60K, which was chosen. The inflation has changed things so much. I don't know where things are at now, but when we did this analysis, but that's the median household income. So it's above and below median household income. We don't have we don't collect the fine detailed data to be able to calculate poverty level. So that's kind of what we did. And so maroon is people with incomes lower than 60K, and the gold is higher. And so you can see there's some pretty big differences in what people were able to do or what happened. One of the things that strikes me, if you go to the very bottom of the slide, there's a 31% difference between the number of people with lower incomes who reported going in late, leaving early, or taking time off compared to people with higher incomes. And that likely is just the structure of the job. I would say probably most jobs where people have a higher income are also more flexible, so they can do that. And people with lower income jobs may be in jobs that have much more structure and less flexibility, is my guess. And so they don't, even if they needed to, they don't have the ability to do that. And so they're having to scramble probably more even to figure out how to fit all those pieces together. I think this is a picture, and we talked about this, the four of us, when we were planning this, is that this is the picture of privilege, really, that people with higher incomes have opportunities to do things that people with lower incomes don't have in terms of support to make things work. And so people with lower incomes are having to juggle all of these things to provide support and make sure their family's working, and don't have the ability to make some choices that may take some of the burden off of them for everything that they have to do. So if you live in a two wage earner household with one of the adults having a fairly high paying job, it makes it easier for the family budget and to make the decision to cut down hours or stop working for a while or take a leave of absence. And people with lower income households or one wage earner don't have that opportunity to do that usually because of the need to keep things afloat. So were there any other ones that really stuck out in terms of the big difference? Purposely being underplayed is another one where family with higher income wage earner, the other wage earner may be able to choose a lower paying job to help things along, help provide supports. So Megan or Alisa, if you have any thoughts about this too.
Yeah, and I would add to that just that the whole relationship between, you know, the disability and poverty and how those issues are intertwined often. Alisa and Megan, please chime in.
Yeah, I'm happy to get us started. I can't say that I'm surprised, even from my own lived experience. I think raising a child or being a caregiver for an individual with a disability is really unpredictable. And I think that's a key part of this. You really can't predict the day-to-day needs and activities, et cetera, that are going to happen. That all of a sudden we get up and I was planning to go to work and ta-da, I can't go today, or I need to go in late because X is happening. You know, I think back to my own child's diagnosis and really trying to make my job work. But I worked in accounting. There are certain days that, you know, I have to be there, we have to close, there's expectations, there's checks that need to be run. I was privileged enough to have a spouse who could say, come home. You don't need to continue to navigate that. Was it underemployment for me? Absolutely. Did I sacrifice income for my household? But I had the privilege to do so. And then take a job in the school system part-time, et cetera, that worked with my child's schedule, that could be flexible. And all of that allowed me to meet her needs while also um, um, still being financially secure. The number of families that I've worked with that's not their reality, and they're trying to balance it. And I think, you know, this doesn't surprise me that, again, the more income you have, the higher paying job you have, the more flexible some of those, you know, especially in this day and age of virtual working and everybody's working from home. A lot of low paying jobs, that isn't an option. We even saw that in COVID, right? You got to go in, you have to face this, you have to be in person. And that actually limits the amount of flexibility and options that families have. And they have to make real hard choices. So this is, I mean, I'm kind of like you, Julie, like it's a little depressing of a reality, but I think it's important for us to reflect on that and how this information drives the policies that we have and how we support caregivers so that they can show up and meet the needs of their loved one while also meeting the financial needs of their family.
I echo everything that's been said. I want to circle back to something that Alisa said earlier about kind of like the stress and the impact that caregiving can have, which I think can't be stated enough. And it makes me reflect on this, the way the item is at the bottom, went in late, left early, or took time off during the day to provide care. Because there's one piece of this where you're providing direct care, right? You're taking your loved one to an appointment, you're going to an IEP meeting, you're setting up services, and that's direct care. But there's this other piece of it that's also kind of, it's hard to transition from an appointment with a cardiologist and then go straight back to work and try to focus and be there and be really present. I can say when my son, who has a disability, I had to take him to the neurologist, and it ended up, you know, what should have been an hour appointment turned into an EEG, turned into getting the results of the EEG, turned into results I wasn't expecting. And I could not go back to work after that appointment. I went through the drive-through at McDonald's and ordered everything on the menu and sat at home and ate it. You know, it's not just the direct care aspect of it that I think impacts employment. It's all these other pieces too that it's hard to measure, but I think really impact and obviously differentially impact in terms of socioeconomic status.
Absolutely. Having to make all those calls to schedule appointments during the day because they're not open in the evening or during non-typical work hours, and playing phone tag, and it's very, there's just a lot. There was we had an opportunity for parents, or it's not just parents, for family members to share their stories at the end of the survey. And there was one story that I read through a lot of stories, but there's one story that's really related to this. And it's just every time I think about this her story comes back. Is she's a nurse at a hospital, and she's a single parent, and she relies on, and I think this ties into the direct support workforce crisis that we also have, is she relies on a paid support person to come in to be with her family, her child. And they won't show, or will call in at the last minute, and she's expected to pull a hospital shift, and there's literally nothing she can do, and it's not a job that's flexible. And then she feels bad because then one of her coworkers has to stay and isn't getting home to their family. And then she feels awful that she's letting her team down, and literally, I mean, there's nothing she can do. And then she's the primary wage earner, and then she stresses about losing her job. And it was hard. It was clearly she's in a really difficult position, because there's a lot of forces in society coming at her right now in terms of in the service system that are really beyond her control. And it's we got to figure it out.
Depressing. Is there, so before we go on to the next one, because we do have one more sort of key finding, it's also very, very interesting to look at, but before we sort of go on to that, is there anything that we should feel positive about here? I mean, for example, this top one, they received a warning about performance from attendance at work. That's the least amount of difference.
The least amount of difference, but it's still half of the parents. So one of the things we did include in this, and this particular one, but there are people who, and on another question, which is hopeful, is that had really supportive employers who understood what their family needs were, and were willing to be flexible and to let them work from home, and they had supportive coworkers who, so sometimes having that situation can help a lot, because then you're not stressed about work, if there's all the other things going on. But and some employers had benefits that supported people to be able to to do this job. So there are employers out there who are doing things that are helpful for families. So it's not all negative. So.
On that positive note. All right. So let's talk about this then. There's one more key finding. Linda, you'll describe it as before.
Yeah. I think nobody will be surprised that there's a difference between people who identified as women and men who that there's difference related to work. The men are the gold color and women are the maroon color. So if you look at this, women were much more likely to be the ones who gave up work, who were purposely underemployed, who went from part-time to full-time, and who went in late, left early, took time off. So they had some long-term effects on their long-term employment, other long-term income, their lifetime income will have some effects from those decisions. Men were more likely to retire early. And we're also more likely to receive a warning about performance or attendance at work, but that kind of makes sense since they were also less likely to have given up work or so if you're still working, you're more likely to get a performance warning than if you're not working anymore. Things were pretty close in terms of taking a leave of absence, losing job benefits, turning down a promotion, or moving to another state were pretty close. Regardless of the which group it was. And I think the thing when I think about this is women have historically been the primary caregivers, that they're also the primary caregivers for aging parents, and in terms of long-term economic impacts on their lives, when they're also more likely to live longer, so they have paid less into Social Security, they may have been able to put less into retirement, and so there's some long-term ramifications regarding this in terms of what happens when these folks get older and they haven't kind of been able to save for retirement in a way that would make their later years more comfortable.
I find this very, very interesting. So I'm going to pose a question to our panel. What are the policy implications of this? And then if there are any particular, data points or particular sort of findings on the slide that you also want to talk to more, then that would be great as well. But so what does this mean, practically speaking?
Well, I can start us off. I think, again, not super surprising that women are kind of disproportionately impacted in terms of economic outcomes than men. Very much the case for caregiving in general, and the case in the disability context. I think, though, when we look at some of these latter ones, like purposefully underemployed, gave up work entirely, went from full-time to part-time, I think somebody could arguably say, well, that happens more with women than men. Women have a child, they might be more likely to go full-time to part-time, or to give up their job to stay home and raise the child. That definitely, there's a gender differential there. I think the difference with the disability context is that you could be caregiving above and beyond, school-age children up into adulthood. And so women may stay home to raise their children while they're young and then re-enter the workforce as they go into school. When somebody has a disability, they might look very different because your caregiving responsibilities look really different. And that then differentially impacts kind of lifetime earnings if you're not going back into the workforce. So that's what I would say, I think, is one of the biggest implications from seeing this.
I would agree with what Megan and Linda said. I think the part I want to pick up too is one, policies that we have around pay equity, I think is really important. A lot of times the woman makes the choice to be the one to step away or take the hit because there is a wage gap that exists between men and women. The woman usually can typically have a lower paying job, which makes it, that's the default. Of course, you're going to be the person to step back or take less income, et cetera. I think the other piece that I want to lift up here is kind of what we've heard from dads that we work with, and kind of societal expectations about who is giving caregiving. So when a man is like, I'm not available, I can't come in, it actually is seen as really outside of their role, and there's less actual flexibility that is awarded to them. And I think that's really important. On the other side of, we see a lot of pieces that impact women, but also what do we think about dads as caregivers? We see that more and more, but I don't know that employers and society have caught up to that. The same level of flexibility needs to be afforded to a dad as would be a mom or a male caregiver. And I want to lift that up because I think this data really kind of brings that out in a way that a bias and who holds that caregiving role.
That's a really good point, Elisa.
That's super interesting. That's that top finding that received about a warning about performance. That's exactly where that comes out in data. Yeah. And that's exactly the explanation for it. Huh.
I mean, and we see this show up, I mean, as far as like in other places, we've heard that said, even as they go to actually give caregiving service or attend doctor's appointments, everybody's surprised that they're there. So it's no surprise that their employer is also like, what do you mean you need to take off? Where's your wife? Where's their mom? Where's that, these are questions that come up. And I do think that thinking about policy from that standpoint is also going to be important as we continue to see the composition of family and who the caregiver is really begin to shift or continue to shift. I won't say begin because it's already shifted.
Thank you. Very interesting. Okay. Linda, anything you want to add on this before we sort of shift and talk about the policy recommendations that families themselves made, and then some additional policy recommendations that our panel would make, and then have a discussion with the audience as well. But anything to add on this?
I don't have anything to add, no.
Okay. Oh. There is a question in chat. During COVID, most states started allowing family caregivers to be paid. What impact would that have on these? Should we push to ensure that all states offer to pay families? Anybody want to take that at this point? Thought of paying families or pushing?
I think we have it on the next slide. It's coming up in the slides, right? I think we've
Right.
touched that. It's a great
We'll address it
segue.
then.
Yeah.
Yep. Okay. All right. So yeah, funny you ask, Sherry.
Yes.
So policy recommendations that were given by families. Linda, you'll go over these and then we'll open it up.
So, most caregivers, thought that being paid to be, to help, to provide some of their support would be helpful, and it would help their family financial situation. Being able to take a partially paid leave of absence from work, if needed. And Minnesota just passed a law, that went into effect this year that will allow, people to do that, so that, we'll see how that plays out over the next few years in Minnesota. And if it helps people who support a family member here. And then income tax or tax credit deduction for people who, to offset the cost of care, people also thought would be helpful. And then having employer provided benefits. So employee assistance programs that thought about disability would be helpful. And then help navigating systems would be a helpful benefit, because systems are complicated. And as Elisa said, if you move to another state, you're basically starting over from scratch. And every system is different and complicated and siloed. And so having more support for that would be are things that family members who've responded to the survey thought would be helpful.
All right. So then I'm going to ask our discussants to sort of add to these or share their reactions, I guess. First, share their reactions to these policy recommendations that were provided by family caregivers. Share their reactions and add to them. I mean, the reactions, my reaction is that these make sense. Let's do it.
I think these definitely, I think Cheryl putting it in the chat and then kind of predicting this might come up. It makes, just underscores how relevant this is, and it does make sense. I do think, to Linda's point, like it's, whenever we're thinking about a policy change, we also need to be thinking about making that process easy and making everybody aware about how to access those services. Because if you introduce a policy change, and just like Linda said, it's siloed and it's complicated and there's lots of paperwork and things to navigate, then you are still going to get this differential impact where some people are able to access that support and some people are not. And so they have to really go hand in hand. If you're going to institute a program where people could get paid for providing support, you have to make sure that everybody has access to that program. Everybody's knowledgeable and able to access the program. Otherwise, you're going to continue to see these disparities.
I think that, I mean, the first thing I'll say, just responding to what's here, I would say the devil's in the details, right? So I think that paying families to be caregivers is fantastic. As a principle, I think the devil's in the details. How much are they getting paid? What are the hoops they have to jump through to get paid? Some states we've seen, they have to meet certain qualifications. One state in particular, and I can't call the state right now, they required that that the family actually join a union, because that's what all the pay like in-home services and supports have to join the union in order to be a part. So there's all kinds of loopholes that I think are important. And we've seen this come out of other domains, such as like looking at kinship caregiving or things like that, where we see, yes, on paper, this looks good. Yes, this would be great for families. How do we, as Megan said, make it easily accessible? And also that it's at a rate that actually helps the family. I think one of the things that we can't lose in that is back to some of the previous slides of we're still underemployed. We're still talking about receiving far less income than what the person would actually be able to make if they were out in the workforce. So is that the solution that's right for the family? I think the other piece is that when we talk about quality of life, is that what that family wants? Do they get the choice to say, I went to pursue this career path and I want to be out there working and care for my loved one? And that choice, is a tension that many families face. And so again, not saying that this wouldn't be right for some families, but that, that's also a reality. And for us to be thoughtful about that as we develop, policies of who does this benefit and who doesn't it? And I think raising that. A couple of things that I think are important to add here is, again, looking at, whether there's agreements or how do we make the process easier for people to have increased choice to be able to move from state to state. I mean, I come from the Washington, D.C. metropolitan area. You have 3 jurisdictions in one really small space. If I move across the line 20 miles from Maryland to Virginia, all of a sudden my whole reality shifts, right? And so how do states have agreements? And we see this set up kind of in special education a little bit, right? A kid moves, they have an IEP. That IEP has to be implemented until we get some things in place in this new state, right? You can't just say, oh, well, we're just not going to have any benefits, right? Or we're not going to offer anything. There are, some structures, not perfect by any stretch of the imagination, but there are some things in place that say there are some protections for that child to have continuity of services while things are figured out. How do we do that on the healthcare side and other, community-based supports in order to make those decisions a bit easier for families when we look at policy? The final piece I'll just add kind of to your point that you raised, Linda, about the home health workers. And I mean, I could give you 1,000 stories about that. And but the level of pay that home health care workers receive and the policies around that and what that process looks like is also policy implications that I think are really important. And again, all of it is the devil's in the details. How do we understand and really build policies that are going to allow and facilitate actual services to be rendered in the home, et cetera? So that's kind of, as I think about, the policies that really could help drive this, that's kind of where I land on it.
There are some questions in chat that I want to bring up. So the first one is actually related to this first bullet point, Linda. Are there any states that actually do offer income tax credit
I
for
don't know
caregivers?
that. I don't know
Are there
that.
any states, are there any
Elise,
states with pending legislation, and also for Megan and Alisa?
I don't believe so.
I mean, I don't know of any either. Yeah.
Okay. All right, next one. Doesn't IHSS, so in-home support services program, exist as a possibility for caregivers to be compensated for some of their support hours? Some states have paid family leave that can be provided. Yeah, EAPs do exist that have case management services, but it is a rare benefit.
I think so. It really depends on where you live, what state you live in. So some states do this, some states don't. And so if you're lucky enough to live in a state that has it, then you get it. But not all states have historically provided compensation for family caregivers.
And the piece can I just add to that, Linda? I
But-
think the piece to that is that a lot of that, what we see is that that's through self-directed waivers. So when you opt to do that, you're saying you're taking on everything. So it's not like I get paid and then I also have somebody
Yeah.
that's helping me.
Yeah.
I'm saying I'm going to do self-directed, which means I fire everybody, that's involved in it. So that actually can be a really tough decision too. I don't know that I want all that responsibility, but I also want to, my time to be, paid for. So, but yeah, some states do have compensation for caregivers.
IHS specifically, I think it's more post-medical, right? It's for people who get released, though I'm not sure how it gets applied across all
Yeah.
states. But it's for people who get released from
Nursing
hospitals,
homes and
nursing homes,
things like that. Yeah. So if somebody's
facilities.
always been at home, they wouldn't have access to that.
Right.
Um, I think also so what Elisa was just the other side of that coin with what Elisa was talking about was a friend of mine who she's actually in that self-directed role. So she gets paid to provide supports for her son but has to do all the other stuff. But there's, she's getting older and is wondering who's going to take over that role. But also she's tired of being that person. And she's like, I would just like to be his mom for a while and not have to be the person who's trying to teach him skills and making sure that like all the paperwork is done. And I just would like to be his mom. And there's just not a good the staffing shortage and everything else that she's just hasn't been able to figure that out, how to make that happen. And so there's also that expecting that family members will fill in that gap is, also unless they really want to, it's also kind of unfair to put that burden, not burden is wrong, but that responsibility on people if they would just like to have a role with their family member where they're the family member and they're the mom or they're the sibling or whatever without having all of the other extra dealing with bureaucracies and systems and things that a lot of us don't have to have in our family relationships. That's not what everybody wants to do, but the expectation is becoming that that's what will happen, regardless whether or not it's the best fit for the family.
I want to read a comment. It's more of a comment in chat, Rachel, if that's okay. I'm going to read yours out loud because I think it speaks to just actually one of the questions we're going to pose for discussion in general. I'm an over 60 mom still providing care for an adult child, and I find a larger portion of my paycheck goes to provide treats and comfort for my child. I am blessed with a husband who keeps an eye on us and takes care of me. However, it would be good to highlight the percent of caregivers' income that is spent on caring for others rather than oneself. So I just want to, it's not necessarily a question, but I think it's a good illustrative comment to many of the issues that we're talking about. And also sort of, I want to open this up for anybody who is still with us. If you want to unmute yourself and just chime in, and also for our discussions, we talk about some of this already, but sort of other non-economic impacts related to family caregiving that are important to keep in mind, especially when we talk about policies and sort of think how to constructively, how to move forward. So if anybody wants to chime in on other things that we haven't talked about or that we have talked about, but just sort of continue that line of conversation, that would be great. Please just unmute yourself and speak up. Or if our panel wants to discuss this as well, please. All right. Maybe maybe this was depressing enough already to
I was
add.
making space for if anyone in the audience wanted to, certainly. I mean, I think the work that everyone does, or if you also are a caregiver, I think understanding that from your perspective would be great. I think there are many non-economic benefits and challenges related to family caregiving. And I think that, again, as I say, there's a lot of conversation and talk about quality of life, like measuring that. What does that mean? Of course, financial security and economic needs are one of them, but there are many things that make that up. And I say that a lot of our policies and the way that we operate and think are really focused on outcomes. Did they get the health services that they need? Did they get connected to this service or that service? But I often say quality of life is about the mess in the middle, right? How long did it take me to get it? What is the day-to-day reality of trying to access what's needed? And so that to me adds to, stress and feelings, the need to feel supported, and to feel like they actually are able to accomplish accessing the needs of the person that they're caring for. And I think that those can't be lifted up enough, because I think you can make a lot of things work around income and finances and all of those things. But again, the exhaustion, the stress, all of that from constantly trying to engage with systems that are complicated and difficult. It's actually not caregiving for a loved one that is the complicated part. It's the systems and and all of the pieces that you have to go through. You love the person that you're caring for, and that's not hard. It's all the other pieces, and I think that's important as we think about building policies that make that road easier for people.
Elizabeth, if you want to unmute yourself.
Yeah, I was just gonna kind of feed off of what she just said, like the same thing as, it's such an impact on your whole entire life, raising a child with extra needs or disabilities. And it's not just the economic impact, but also, friendships are different. Family dynamics is different. Trying to get people to understand what it is like when they only have a small glimpse of the life is very difficult. Making those connections with other people who understand it is super vital. And I feel like even for our family, we've lost a lot of friends that were close to our family because they just are living different lives than we are. And, they have different, and that's common in anyone, whether you have a child with an extra need or not, or a disability. But I definitely think it's very common to, feel isolated and alone. And to be able to connect with other parents is so crucial, and connect with other people that understand what's going on is vital for families.
Thank you. Megan, Linda, anything you want to add to this discussion? Okay. I'm going to go to sort of our last discussion question, which is really now trying to talk more about policy recommendations and specific policies that we could think about. So in addition to the ones that we talked about, what else could be done? What else? Are there any models out there that we know about that are interesting, innovative, could be adopted, being piloted right now? This is for the audience as well. Are there innovative ideas that are floating around? Are things trying out? Are people trying out things? Is it time? Is it a good opportunity somewhere to try to leverage this moment? So what can we think about constructively? Does anybody know about anything?
I think Elisa's comment about, looking at making Medicaid waivers transferable across states and using the Individuals with Disabilities Education Act or IDEA as a model for how to do that, I definitely echo. It is not a perfect way to do that, but it's nice that there is a model there of a federal program that does have state-specific regulations with it and does allow you to move from state to state and not lose necessarily your services, at least not right away. Right. And I think the only additional thing, and we've circled around this as well, but like in IDEA, the safeguards that you get at every IEP meeting, those procedural safeguards are on average written at a 16th grade reading level. So you have to have graduated college to actually understand what your rights are. So I think whenever we're talking about policy recommendations, we have to talk about making them available in plain language so that people can understand and access their rights and be able to get those services and supports. But I really liked your recommendation about we've done this with other policies, like we could do it with Medicaid waivers. And it's so much easier to do something when you have an example of how it's already been done. So thank you for mentioning that, because that was a really good thought.
Linda, your thoughts? You were unmuted.
Oh, yeah, I don't know. I don't want to unmute it. I think that there's probably, and I'm going to say this without having a specific example. I probably shouldn't say it, but there's things going on in the aging world, related to supporting family caregivers, that we could look at in terms of how family caregivers are getting support, in terms of thinking about communities and how they support people to sort of age at home, where there's lessons that could be learned from that we could maybe think about how they might apply to families who are supporting a family member with a disability. And yeah, I wish I had the thought and I unmuted and then the specifics left me. But there are other sort of systems where they're trying some new things or have done some things over the years that may or may not be completely effective, but are things to consider. I think one of the I'm trying to think how to say this sort of tactfully without being like overly political, but there seems to be sort of a thought in society in general that if you have a child who has needs, well, you decided to have kids, so it's on you to manage everything. But on the other end of the spectrum, if you have parents that are aging, where we seem more open to providing supports, maybe because people don't think, I mean, and this is a half-baked thought, but it always feels like there's, and I don't want to pit caregivers against each other because that's not helpful. And it's not what I'm trying to do, but I think there's more acceptance for the thought that if you're supporting an aging parent, that you need help than if you're a parent. And maybe I'm completely wrong about that, and it's just people that I know, but that thinking about what's going on in overall the caregiving world, that can be applied better to family members who are taking care of somebody with a disability would be might be a useful examination of what's going on.
Linda, I think you said it. I mean, yes. And especially I think we can see more acceptance when you're talking about a child with a disability or special healthcare needs, right? We can see, yes, of course you have more needs. As that individual ages, they have needs that I may still need to care for. And that understanding is not there versus if I come into your office again and say, it's my dad, it's my mom, instead of it's my 35-year-old child. And people are like, well, what do you mean? And not understanding. I mean, and that gets wrapped up in, again, trying to, like you, be sensitive to, what role does ableism play? What role does, who's responsible? How do we think about people aging and disability over time? Are some people's thoughts more static around childhood? And then, once you're, into, your older years, so I do think that, it's that similar complexity of, again, how we think about dads and men and the role of that, right? Like those societal beliefs, I think really do play a role in how we think about policy. So I appreciate you lifting that up.
Any reactions from the audience? Anybody wants to chime in? In chat, Linda, I think what you just referenced has to do with the devaluation of people with a label of an intellectual and developmental disability. How many families are still being told by their doctor to put their disabled child away somewhere? I think there's agreement on that.
Mm.
All right. Please, go ahead. Alisa, you were gonna say something? No. Okay. Sorry about that. All right. I think this kind of brings us to the end of the discussion, unless to me, this has been very fascinating and very interesting conversation. I really appreciate the honesty and the fact that we are, of course, cognizant about how we talk about things, but also are not afraid to sort of raise the issues that need to be raised. So I appreciate that. Linda, there was an earlier question about like the data. So question for you, this data, the finds data, there's going to be another round of data collection, right? So we're going to have
In
results.
2020, oh my gosh, 2026, 2025, 2026. So it'll be, about 5 years from this last one. So our plan is to sort of do these every five years. If you have more specific questions about data, it's email me. I'm happy to pull data. If you have a state specific question or something like that, just let me know. And the actual the report, which is written in as plain language as we could have managed, is online at the ICI website.
So it'll be interesting to compare also the results over time, and so how and if some of this is shifting. Okay. So I think that with that, I can basically close out the forum. Thank our discussants for a very, very interesting conversation. Megan, Alisa, and Linda, thank you very much for your time and for being willing. On your screen, you will see links to the policy forum and recording and the briefs. The recording will be posted. Usually takes a couple of weeks. The slides will be up there too. But in the meantime, if you want a copy of the slides or a copy of the brief, you can also email myself or Linda. Thank you very much. Have a good rest of your Friday and a good weekend.